In the Olympics during the mid-70s, it was rumored the Russians were using a special sports enhancement drug because they seemed to dominate so many events. Later it was found that some of their athletes were on steroids, but many, if not all, were using pangamic acid or vitamin B15. B15 enhances the methylation process. You see, energy from the methyl groups do not follow glucose or the Krebs cycle. Methyl groups are combusted by way of a faster alternative route. So athletes, especially performance athletes, can really feel the difference. But guess what? In today's crazy lifestyle, everyone is an athlete. Don't you feel like on some days you've been running a marathon? After all the excitement about the Russian athletes, biotics researchers were able to create Organic 15, a specialty B15 product that supplies biologically active methyl-related culture concentrates along with natural, organically bound trace elements and enzymes. Although I started our discussion with increasing athletic performance, most of the feedback I've received from clinicians has centered around increasing oxygen utilization. This feedback came from a trusted friend and colleague regarding an asthma patient she was treating. One asthma patient I was working with was on several bronchial inhalants and 2 of the strongest asthma medications on the market. The dose he was taking was so high that it was at the toxic level. The doctor prescribed it because it was the only dose that gave him some relief. The relief was limited, but at least he felt like he could breathe. This patient had lung damage as a result of firefighting. He was exposed to chemical toxins while at work and lost 60% of his lung capacity. Because this was a permanent condition, he was immediately put on disability and he had to retire at the age of 40. This was a huge loss for him as he loved his job. I suggested the Organic 15 because prior patients had reported increases in physical activity by as much as 20%. The initial dose was 4 times per day. I also added Pneuma-Zyme from Biotics. Pneuma-Zyme contains neonatal lung tissue concentrate as well as vitamins A, C, E, and selenium. The initial dose was 3 times per day. I also recommended he avoid offending foods that increase mucus like dairy products and gluten grains. He had such remarkable progress that he and his doctor were able to reduce the amount of medication as well as eliminate 2 of his inhalers. His energy improved, as did his wind. He was able to perform a higher level of exercise and soon was running 5 miles per day. Within a month or so, he was able to completely stop his toxic asthma medications. Now, over 10 years later, he continues taking the Organic 15, but at much lower doses. He takes 3 tablets per day and has been able to stop the Pneuma-Zyme. He is medication-free and uses 1 inhaler only as needed a couple of times per week. That's awesome! Someone with a 60% lung disability and is now medication-free? I've personally used Organic 15 successfully with patients that were suffering with asthma, emphysema, and other upper respiratory problems like bronchitis. Organic 15 should also be considered and has been found beneficial in cases where increasing methylation may benefit the patient, such as increasing endurance for sports performance, morning sluggishness, stubborn cases of biliary stasis, and is a part of a program for patients with autism, angina, and unresponsive elevated homocysteine. Methylation is important for the integrity of the myelin sheath. Therefore, Organic 15 should be considered as part of any program with patients with MS or other problems involving the myelin sheath. Another interesting application may be for people who live in large cities. In Europe, methylated products are considered helpful protectants from pollution, especially carbon monoxide. Personally, when driving long distances, I take Organic 15, 3 tablets several times a day to reduce what I call the road buzz, that foggy feeling from secondhand exhaust fumes. You'll find more information about Organic 15 to the right. It supplies both methyl donors and acceptors, has a detoxifying effect, and has a unique value as an energy source. It's so unique, it's one of my favorite supplements. I like having it on my shelf, and I find it can be used in a wide range of clinical applications. As you know, there can be many pieces to the breathing puzzle. The link to the right summarizes some of them and gives some nutritional suggestions that will help you solve them. Food allergies, respiratory infections, gastrointestinal reflux, obesity, reduced exposure to irritants, external factors in the home, air pollution, heavy metals, drug interactions, adrenal exhaustion, bedroom concerns, and hypothyroidism can all contribute to reduced oxygen utilization. Thanks for taking time to join me. I look forward to being with you again next Tuesday.